The pelvis is the one attachment between the axial skeleton and the appendicular skeleton of the lower extremity. The pelvis is made up by two innominate bones on either side and a sacrum in between the middle. A lot of students avoid studying the pelvis, specifically the innominate bones, in any kind of detail. Why? Well, it's a scary looking bone, okay? But if you study this bone and you know it well, it will make your study of the surrounding structures much easier. This innominate bone directly interacts with the gluteal region, with the inside of the abdomen, with the abdominal muscles, with the different compartments of the thigh, anterior, medial, and posterior. So all those muscle attachments will become very clear if you get to know this bone very well. All right, so let's get started. So from this image, we can see the innominate bone, and this view right here is a lateral view. And what you can see here directly is the acetabulum. Now, the acetabulum is going to be the union between the three bones that makes up the innominate bone. So you're going to have the pubis, which projects out anteriorly. You have the ilium, which projects upwards superiorly, and then you have the ischium, which projects backwards or posteriorly. And these three parts come together to make up the innominate bone, which all meet up at the acetabulum. So let's take a look again at this lateral view of the innominate bone. Over here we have the ilium, the entire ala of the ilium, and since this is the lateral view, this is the posterior surface of the ala facing towards you. So this is the gluteal surface that we see over here, okay? Now I'm going to rotate this slightly over here so you can get this whole posterior surface in clear view for you. And what you can see is that on the top of this, we have a edge, which is a crest, okay? We call this a crest. This is known as the iliac crest, okay? This is going to serve as an attachment site for a lot of these muscles that form the abdominal wall, the external oblique, the internal oblique, and the transverse abdominis, okay? Then what you see is that at either end of this crest, there's going to be a point on this end and a point on this end over here, okay? So if we orient ourselves again, if this is the lateral view, then this is anterior over here, and this is going to be posterior back here, okay? Which means that this is the point on the anterior side of that iliac crest, and this is the point on the posterior side of that iliac crest, okay? We call these spines, okay? So this is going to be a spine on the anterior side, spine on the posterior side. This is your anterior superior iliac spine. Why superior? Because it's contrast to the anterior inferior iliac spine, which is this guy over here. There's also a posterior inferior iliac spine, which is this guy right here, okay? So all together, there's going to be 4 iliac spines, 2 of them which are located superior and 2 of them which are located inferior, okay? So those are going to be your 4 iliac spines all together. And these are the 2 superior ones, and these are the 2 inferior ones. And then you also have 2 posterior ones and 2 anterior ones. So altogether we have anterior superior, posterior superior, posterior inferior, and anterior inferior iliac spines, okay? And this right here is the entire gluteal surface that we're looking at. And this is going to be direct attachment for gluteus minimus, gluteus medius, and some of gluteus maximus, okay? Now, that's the ilium. That's what I wanted to point out for the ilium in terms of main attachment sites. So not too many distinct muscles attaching to these 2 sites. It's kind of like a bunch of different fascia and different muscle tissue that blends all together back here. The gluteus maximus definitely attaches here. But what I want to point out is the attachments on this anterior iliac spines. So this anterior superior iliac spine is an attachment site for one muscle in particular, which is your sartorius. And this, the anterior inferior iliac spine, is the attachment site for one out of the 4 quadriceps, which is your rectus femoris, okay? Now, that makes sense looking at where these are, right? These are located on the anterior aspect of the bone, and the sartorius and the rectus femoris are 2 muscles that will run towards the anterior compartment of the thigh, all right? Now, when we turn this back to the lateral orientation like this, we see the pubis projecting anteriorly like this, and The pubis itself is going to be made up of two rami. So there's going to be this ramus on the superior side and this ramus on the inferior side. Ramus just means branch, okay? So this superior ramus, and this is the inferior ramus. Superior pubic ramus, inferior pubic ramus. Got it. This is the whole body of the pubis. And this specific point right here is the pubic tubercle, okay? If you take two pubic tubercles and put them close together and you make the symphysis joint in between the two, you get a pubic crest. Now, the pubic rami are going to serve as attachment sites for muscles in the anterior and the medial thigh. And that makes sense also. If we turn and we look at this from the anterior view, we can see that this being my right innominate bone, the medial compartment of my thigh would lie right here where my hand is, okay? So a lot of those medial muscles, such as the adductors of the thigh, are going to have attachments to this inferior pubic ramus right here, okay? And some of them may have attachments to the superior pubic ramus right here, okay? Next, we're going to look at the ischium. Now, the ischium is the one that is facing out posteriorly like so. The ischium is also going to have a main body, which is here, and then it's going to have the ischial ramus, which is this part. Notice that the ischial ramus and the inferior pubic ramus are both forming this one piece of bone right here. They both join together to form this one piece of bone right here, okay? Now, the ischium itself, the main thing to point out is going to be this big rough patch of bone that we have all the way on the posterior side. These are also known as your sit bones, because right now, while I'm sitting down, I'm sitting on my ischial tuberosities, okay? That's the bony part that makes contact with your seat. This is the attachment site for all of the hamstring muscles in the posterior thigh. All the hamstring muscles in the posterior thigh will come together to form one massive tendon that will then insert onto this ischial tuberosity. That is your common hamstring tendon. When somebody says they tore their hamstrings, 9 times out of 10, it's happening right at that common hamstring tendon. So that's your ischial tuberosity. Another thing I would point out now, looking from this posterior view, is that we can see this right here. So remember what we call these points on this bone. We call them spines, right? So these were spines on the ilium, so we called them the iliac spines. This is a spine right here that belongs to the territory of the ischium, okay? So this is going to be your ischial spine. Got it? Now, the ischial spine is going to divide two notches from each other. Follow me closely here. So notice that this spine is right in between this notch, this smaller notch right here, and this larger notch right here, okay? So this spine is the ischial spine. This is the greater sciatic notch, and this is your lesser sciatic notch. If you've heard of your sciatic nerve, you'll know that when you do the dissection of the gluteal region, you'll find your sciatic nerve coming out through this greater sciatic notch, okay? So this is greater sciatic and this is lesser sciatic. There's also going to be some ligaments in the gluteal area that are going to be attaching to the ischial spine or to the ischial tuberosity, such as the sacrospinous ligament or the sacrotuberous ligament. And these are going to form foramina in the gluteal region from which neurovascular structures exit the pelvis to then enter the gluteal region. Okay, so that's the relevance of these landmarks right here. And our discussion would not be complete without talking about the iliac fossa. So right now the innominate bone is facing you anteriorly, and this is the anterior surface of the ala of the ilium. Okay, so this is where the abdominal viscera sits on this ala. But before that, there's going to be a muscle that's lining this whole entire surface. Okay, the muscle that lines this surface is known as the iliacus. And your iliacus is going to join together with another large muscle that runs on the lumbar vertebra somewhere around here. And the psoas major and the iliacus are going to come together to form a muscle known as the iliopsoas, which is the main hip flexor of the body. So those are the main bony landmarks of the innominate bone, and you now understand the 3 different bones that actually make it up, so you can conceptualize these 3 different parts of the innominate bone in order to learn the whole bone in more detail. If you like this video, please hit the like button. Don't be stingy with your likes. Also subscribe for this video as well if you want to be alerted for future videos. I do have videos that are associated with this one, such as the video about the femur and the hip, which talks about the acetabulum in more detail and also talks about femoral neck fractures. So that's related to this material. If you want to check that out, I would suggest to check that out as well. Thank you for watching my video. If you have any questions or you have any topics for future videos you'd like to see, please leave it in the comments below. All right, see you guys next time.